This lesson is on directional terms. When you think of directional terms, it's best to think of them in pairs. With that being said, let's begin. Anterior and posterior are the first two we're going to talk about. On this diagram, it doesn't actually show them, but anterior is toward the front of the body, such as the sternum, and posterior would be toward the back, such as the vertebrae. The next pair we're going to talk about is superior and inferior. Superior is closer to the head or the cranial area, whereas inferior is closer to the pes or the foot area. So you could say that the liver is superior to the stomach. The next pair that we're going to talk about is medial and lateral. When you think about that, it's best to divide the body straight down the midline, as this line shows. Toward the midline is medial. Away from the midline is lateral. So toward this side is lateral. Toward here is medial. The next pair is proximal and distal. When you think of proximal and distal, this is basically just with appendages. Proximal is toward the point of attachment. Distal is toward further away from the point of attachment. So the fingers are distal to the humerus, which is more proximal. You also have superficial and deep. Superficial would be toward the surface of the body, such as the skin. Deep would be to the bone. So skin is superficial to bone, or bone is deep to the skin. Those are the main directional terms. Thank you for listening.